Hello there, I'm Kristen, Doctor of Physical Therapy at Into the Light Healing and Bodywork. This therapeutic exercise flow is designed for a patient to advance her core and lower extremity strengthening with some modifications to a few of the exercises. We will use a chair and blocks, so when you have those ready, let's get started. All right, we are going to begin sitting on a chair or on the floor if that's what you're comfortable with, doing breath of fire. So I'm going to actually have my body turned to the side so that you can maybe see the change in the belly as we go through this exercise. I invite you here to start whatever position you're in with your hands on your belly, and remembering that breath of fire is a passive inhale and a forceful, strong exhale, quick exhale. We're going to make a shushing sound as we breathe out, exhale. And we'll do about 10 breaths, take a little break, and then repeat. So, with a nice big inhale to start. Notice how I forcefully pull my belly button towards my spine to breathe out and make that sound. And then quickly, passively, the air just comes in to the body. So it feels kind of weird to do this, and that's all right if you need to practice. That's the point of these flows. So inhaling here. We want to do maybe just about 10 at a time because it's easy to get lightheaded doing this. It really changes the ratio of oxygen, carbon dioxide in the blood. So we're just going to take it easy on this beautiful sunny day. And the speed, of course, you work up to it. You can even do this one a little bit slower if you'd like. Notice how my posture attempt is to continue to lengthen the spine up, keeping a lordosis, a curve through the low back, kyphosis through the upper back, curve in the opposite direction, and then a lordosis through the neck. Could go off on a tangent here about how we've really lost that cervical lordosis because of our forward heads and all that we do forward, but that's why we're practicing. We're trying to keep our spines nice and elongated, if just for this 20 minutes or however long it's going to be. And then being mindful of our posture and these natural curves that are in our spine, we're going to move into abdominal rotation. So thinking about moving, starting with the pelvis, abdominal muscles doing the work here, moving the rib cage forward as we stick the tailbone back, and then over, shifting the torso over to the right. The right sit bone takes the weight here, and then we tuck the tailbone under and make a curve through the low back, the opposite curve of a lordosis, and then turn the weight over to the left side with that curve still happening there in the low back, and then we shift the weight forward, increasing the lordosis of the low back. Belly comes forward, abdominals always engaged here, and then repeating, redoing the circle. Option to flow with the breath here, breathing in as you go forward and to the right, breathing out as you go back and to the left. Continuing to flow, and notice how my shoulders are pretty much staying over the hips. It's really the pelvis and the abdominals and the low rib cage that's doing most of the motion here. Abdominals at work. Don't worry if you got some soft tissue getting in the way. It's kind of like a little massage. Next time you're forward, I invite you to reverse your circle, shifting over to the left, then backwards to the right and forward. Remembering that the motion starts with the pelvis, maybe even thinking about the tailbone itself and the little circle that it's drawing on your chair or on the floor. If you have spinal stenosis, lumbar stenosis, or spondylolisthesis, any of those conditions where you're not supposed to arch your back, please don't arch your back here. Keep your spine in neutral. Instead of shifting that pelvis really far forward like so, kind of keep it in a nice neutral position. A little bit of lordosis is natural. We just keep it with the normal curvature of the spine. Don't do any extra like so. Just a nice long spine when you're coming forward and shifting your weight. And then go ahead and allow the tailbone to tuck under and the pelvis to tilt backwards. Long spine, not extra lordosis. Just work with your anatomy, and if anything feels sharp or pinchy, don't do it. It's not always pushed through, and I have never, even as a physical therapist, I do not love the no pain, no gain phrase, slogan, whatever you want to call that. If your body is in pain, there's tissue that's dysfunctional, so don't push through it. Find some healing, and you can do that with exercise. Okay, that's enough of these. All right, so next we are going to use the chair to do thread the needle, or not, if you do not need a chair. This exercise you can either do with the back of the chair if you need a little bit less weight bearing through the hands, or you can bring the hands to the seat of the chair for a little bit more weight bearing and a little bit more advanced exercise. Or if you want to be on all fours for this, that works too. So, as we put all of the weight of the upper extremity into the right hand, we're going to press into the right fingertips. Lengthen the spine, pull the belly button in and up towards the low ribs. Left hand is going to reach out and up as we inhale. And then as we exhale, that hand is going to dive down underneath that right side body. Twisting just as far as you can go comfortably, finding a nice stretch, and then coming right back out. We're going to inhale and reach up towards the ceiling. Nice stretch here too. And then exhale, dipping under again. We're going to try to keep even weight bearing on each foot, not gripping through the toes. So feel free to lift those up if you need to. And trying to keep a pretty level pelvis. It'll move a little bit, and that's how it's supposed to be. Let's shift to the other side. The left hand gets the weight of the upper body, pressing into each fingertip. Inhale, right hand goes up and out. And then we exhale, bringing that right hand underneath the left side body, finding a nice stretch here. Moving with the breath, even weight bearing. You got this. One more. Integrity through the shoulder is important too. Pushing that out and down, not really letting it collapse up by the ear. And then we'll return the hands here. All right, so option 2, step the feet forward or bring the hands to the shins or knees, wherever you're at. And then engage those abdominals, pull that belly in and up, tuck the tailbone under, and roll up one vertebrae at a time, comes into a standing upright. All right, we're going to ditch the chair here and come onto all fours. If your wrists are bothering you, or you're more comfortable this way, you can absolutely make a fist and use that instead of putting your hand down and pressing into your fingertips. And we're going to have the hands, wrists underneath the shoulders, shoulders pulled down the back, tummy engaged, and the knees placed underneath the hips. Okay, so the toes can either be tucked under or feet flat on the ground. As we inhale, we're going to drop the belly down, keeping the abdominals engaged. Inhaling, bringing that chest forward, neck lengthens. And then exhale, tuck the tailbone under, the low back curves, and then the neck relaxes. Continue pressing out through the shoulder joints. Inhale, reverse it, tailbone points away, belly drops down, lengthen the spine, chest forward. And then exhale, tuck the tailbone under, press the back up towards the ceiling, press out of the shoulder joints, neck relaxes down. Inhale, reversing. Continue flowing with your breath and feel for what motion, or if there's a restriction, feel for what will help your body in this moment. See if you notice an increase in range of motion of your spine the more we do. And never lose integrity through your joints. Continue pushing out through the shoulders. Even weight bearing through the hips, level pelvis. And then come back to neutral. Grab your blocks. We're going to put one on each side here. Figure out an alignment that works good for you. And then we're going to step the left foot up into a low lunge. So left foot comes up between the hands. The blocks help bring the floor up to you so that you can get your body a little bit more out of the way without needing as much range of motion through your hips and knee and all that kind of good stuff. So from here, we're going to tuck the right toes under. Lift the right knee. Feel that nice stretch through the right calf. Just be here for a moment, it feels so good. And then when you're ready, pull that belly button in and up. Bring one hand and then the other up to the left knee. Walk your hands up the thigh and bring yourself into an upright position. We're then going to plant the right foot. The heel's going to go down at an angle, so toes are turned out maybe 45 degrees towards the edge of the mat. And we're going to pull the shoulder blades down the back as we open the hips up to the side, long edge of the yoga mat. Press the left knee back so that it stays over top of the ankle. It tends to collapse inward when we do this one if it's too much. So either shorten your step or think about pushing your knee backwards. All right, and then we're going to stretch our shoulders and our arms as well, bringing one hand in each direction at shoulder level. Turn the head to look over the left fingertips. And take a breath. Belly is still working, engaging those abdominal muscles. Try not to let the torso shift forward, kind of arching that low back. We don't want to see that. Keep that strong. And then we're going to let our arms down. Straighten the left knee. Turn the left toes to the front and turn the right toes to the front. If you are able here, I invite you to bend over and pick up your blocks and move them to the other side. And then hands to hips, come back up. Then we're going to turn the right toes to point towards the edge, the short edge of the mat, and the left heel is going to go back a little bit so that the left toes are pointing out about 45 degrees. From here, we're going to keep that knee over top of the right ankle as we bend the knee. Try to keep a nice open hips here. Belly is scooped in and up to engage. Low ribs are knit together. Then we lengthen out through the shoulders and the arms and the fingertips, looking over the right middle finger. Spine is engaged, long. Chin is tucked slightly towards the throat. Sink a little deeper if you can. Keeping that knee, though, over top of the ankle is most important. I just find myself coming up a little bit sometimes. Awesome. All right, let's lower the hands to the knee. Then we're going to turn the torso, allow that left heel to lift up. We're going to go into a lunge here, hands to the thigh, maybe even hands to the knee, and then maybe even hands to the blocks. Feel those quad muscles working, the left calf stretching. And then plant that left knee down. And bring the right foot back so that your knees are together. I'm going to go ahead and get rid of my blocks. And we're going to be on all fours. If you're interested for a little challenge today, tuck the toes under. And then pressing down through the hands, really get out of the shoulder joints, lift your chest and torso, engage the abdominals, lift the knees an inch or two above the mat, pressing into the toes, pressing into the hands, engage and hold for 5, 4, 3, 2, 1. Good job, lower down. That's a hard one, but I like it. Builds those quads really well. Okay, so next thing we're going to do is a little stretch for the side body. So let's go ahead and pivot so we are on the right side. On the elbow, right underneath the shoulder, the forearm is going to be turned out about 45 degrees. And we're going to stretch the legs out nice and long here. Hips are stacked, knees are stacked, and ankles are stacked. From here, this is a balancing posture too. So we're balancing and stretching at the same time. You can use your top arm to give you a little support here, but what we'll do is lengthen up and over, letting the head tip over the right shoulder and getting a nice stretch through the left upper trap, the left side of the neck, and also letting the right side body kind of sink towards the floor a little bit here. So it's an interesting combination here to balance, letting the right side body sink and release towards the floor, as well as allowing the head tip down towards the floor. But I believe in you. You can figure it out. If you notice your shoulder collapsing in, just press into that elbow again. If you need more of a stretch, this can be performed on the wrist as well, with the arm tucked nice and tight to the ribs. All right, then we're going to come onto our bellies. And hands are going to be right underneath the shoulders, forehead to the mat. Bring the toes together, press the pubic bone down into the mat, And then using the low back muscles, we're going to lift the head, lift the shoulders, lift the upper back, lengthening it up and away from the low body. And release down. Next, we're going to repeat that side body stretch on the other side. So rolling onto the left side here. Elbow is right underneath the shoulder. Our forearm is turned out about 45 degrees. Hips, knees, ankles stacked and in one straight line as if you were on a tightrope. We're going to let that left side body sink towards the floor while we still press into the left shoulder. Let the right neck stretch out as we tip the right ear over the shoulder. Pull the shoulder blade down your back. That helps to lock in the shoulder in a good position. And breathe. Find some ease here, some length. If you need some support for balance, go ahead and use that right hand. And then we're going to bend our knees and roll onto our backs. Let's go ahead and keep the right knee bent. We'll place the right foot on top of the left thigh or on top of the left shin, whatever works for your anatomy. It's okay on the knee too if you need that. We're going to bring our arms out to the sides in a big T. And then with an exhale, we're going to scoop that belly button in and up as we release the right knee over to the left side. Try to keep the shoulder blades close to the floor here and turn your head to look towards the right hand. If you feel any pain or discomfort, back off a little bit. It's okay. Just work with what you've got. You can also place a block under the knee here, actually, if you want to rest in this position for a while and you're hovering above the floor. Placing a block there is really helpful to release into the stretch and not have to worry about hurting. I like to feel for that. It's almost like a stretching deeper. With an exhale, it happens when you hold a pose for a little while, hold a position, a stretch. It's like the body is like, oh, this is okay. I can let go a little bit more. Let's go ahead and bring it to the other side. Level out the pelvis. Bring the left foot on top of the right lower extremity somewhere, and then scoop the belly button in and up and bring the left knee over to the right side of the body, trying to keep the left shoulder blade down on the floor. Turn the head to look at the left hand. Enjoying this winding down. Go ahead and bring the legs back up. If you're comfortable laying on your back, I invite you to do so now, just stretching out the legs, or tuck a couple of blocks or a bolster underneath the knees. That's usually a pretty good one. Putting a pillow underneath your head if you need one. But somehow finding stillness to relax for a moment before continuing with your day. Noticing the body, where you feel stretched, where you feel tired. If there's anything you need to adjust for next time. And then make your way onto your side, maybe bending your left knee to push your foot into the floor, rolling you onto your side, pushing up into sitting. Notice your spinal alignment here. Feel free to use a chair, of course. The light and spirit in me honors and appreciates the light and spirit in you. Let peace be with you. See you next time.